You should have just gotten a notification that recording is in progress. So thank you for joining us on our talk on pets and eating disorders. I am Dr. Stephanie Lehto. I am a psychologist in Colorado, and I work at the CU Anschutz Student and Resident Mental Health, Faculty and Staff Mental Health, and OCD program. And I like talking about eating disorders and I like pets. So this is a great talk for me. And I'm going to pass it to Barbara.
Hi, my name is Barbara Cooke, and I am actually a professor of criminal justice and criminology at the University of Kaiser University. And my background is I do have a background in psychology, which is one reason this is very interesting to me. But my primary area of research during my doctoral studies was on dog training programs and human-animal interaction and animal-assisted interventions. So that is what brings me around here. Thank you.
And I'm Rachel Davis. I'm a psychiatrist here at University of Colorado Anschutz, and I'm the vice chair for clinical affairs in the Department of Psychiatry and also the medical director of our OCD program. And I just like animals a lot, so that's why this talk is interesting to me.
All right, I'm going to share my screen and hope I do a great job with it. Okay, I think that you all can see the appropriate slides. So that's us. And we're going to talk on pets and eating disorders. And I need to move some things around so I can see. Nope, that was wrong. Sorry. Okay. All right, so this is a picture of the best puppy in the world. His name is Loki. But I wanted to start off with a quote that is intimacy with a beloved pet or special animal makes millions of people feel as though they win the lottery every day. And I think that any of us who have pets will feel like, yeah, we do win the lottery every day because our babies are so appropriately fun. And also Loki's cute, so take some time to admire him for a second. Okay, so we want to start off and give some diagnostic clarification of eating disorders. I'm not going to go through this in detail because you can read the slides. But when we think about different eating disorders, some of the more common eating disorders that we talk about are anorexia nervosa, or AN. And anorexia nervosa is when someone is intentionally restricting energy or caloric intake that leads to a significantly low body weight. There is a fear of gaining weight or persistent behaviors that interfere with weight gain. So like typically with the weight gain, what would happen is someone would not eat food and they would restrict the food. There's also a disturbance in body image. So one may feel that their body and shape looks different, or they have a different type of evaluation of their weight and shape. They have significant concern with weight and shape. Or lack of recognition of how their low body weight is impacting them. And there can be a couple of ways that this shows up. There can be restricting type, which is restricting caloric intake. And then there is binge eating purging type, which means someone engages in binging and purging behaviors. There's also bulimia nervosa, which is when someone engages in binging, which is described as eating more in a discrete period of time than others would in a similar circumstance, and a lack of control over eating, and then engaging in compensatory behaviors for the binge, which would be like purging behaviors is typically what people think about, but it can be it's self-induced vomiting, misuse of laxatives, diuretics, excessive exercise. There's also binge eating disorder, which is that discrete period of binge eating, eating more than others would in similar situations and having a lack of control over eating, but there is no purging behaviors typically with that. There's also marked distress with the binging. What's important about anorexia, bulimia, and binge eating disorders, there is typically a concern with body image. And I say that because there's also avoidant restrictive food intake disorder, or ARFID, where someone does have they typically do not meet weight expectations for their age or have a significant loss in weight and have nutritional deficiencies and may rely on external supplements or feeding tubes and things. But there is not a concern with body image typically in ARFID. So that's a way to tell the different eating disorders apart. And then, of course, there's other specified food eating disorder or unspecified eating disorder, which is someone has some symptoms of eating disorder behaviors, but they don't meet full criteria. And so this could be atypical anorexia, where someone may not meet the the weight requirements or the weight expectations, purging disorder and night eating.
All right, so I thought it'd be fun to talk a little bit about disordered eating in dogs. And I'll give the caveat, I am not a veterinarian, so this is my lay person's understanding of disordered eating in dogs. But we're gonna look at overeating, undereating, bolting food, also sometimes called wolfing food or just eating food really fast, and pica, which is eating things that are not food items. And then a type of pica is eating poop. So we're gonna talk about that briefly. And this picture here is my previous dog, Zia. She had diabetes and she was also on prednisone. And so anything and she had a dog door. So anything that came into the yard that was even remotely resembling food, she would get into. So I had to leave all sorts of signs and stuff so people stopped putting birdseed or other food items on the ground. So, all right, next slide. So overeating, this is an example of a package that Zia got into. So she had diabetes, which we'll talk about is one of the disorders that can lead to increased hunger. It's because dogs with diabetes aren't able to utilize glucose or energy correctly. But even though I managed her diabetes well, she was also on prednisone, which increases appetite. So overeating for dogs is usually the most common cause would be overfeeding. So they're human is giving them access to too much food. And dogs are opportunistic eaters, as in if there is food to eat, they will eat. They aren't likely to limit their food on their own. And the problem with this is overweight dogs are at risk for joint problems, heart disease, liver disease, kidney problems, and a shortened lifespan. There are some illnesses that cause increased hunger. So diabetes, one of them, but also disorders of the thyroid. Cushing's disease, which is a disease that increases cortisol. Humans have it too. And then just as dogs get older, they may need less food because their metabolism is slowing. And so treatment, if it's overfeeding, it's simply portion control. And we'll Stephanie will talk about this in a few slides, but for someone with an eating disorder, portion control can be tricky. And so, there's a fine line between doing what is healthy for your pet versus doing something that's compulsive and maybe disordered. One way is if you have a dog that seems hungry is just simply adding volume to the food by adding vegetables, things like green beans or carrots or broccoli. Some dogs actually really like those and giving them as snacks. All right, next slide. And then undereating. So undereating most commonly is not like a psychological thing for dogs. It is most commonly a sign of an underlying disorder. So it could be like an acute illness. So let's say they have a urinary tract infection, or can be a sign of a more chronic illness like cancer. So if your dog doesn't eat and it goes on for more than a day, you probably want to take them to the vet. However, it can be psychological. So if they have a new environment where they have a lot of separation anxiety and you're gone on vacation and they don't eat for the first couple of days with a pet sitter, that may be a psychological cause. And dogs do get depressed as well. So if they lose their primary owner or they lose a sibling or a housemate, it can affect their appetite. And then also you may have a picky dog, right? So let's say you got a puppy and whenever it didn't like something at all, you switched up its diet. So it ended up on this really palatable, fun diet. It may not want to eat other food. Or I'll give an example. I adopted a 13-year-old dog who before coming to me was living on the streets. And so my guess is she was probably used to eating things like fast food or really whatever she could scavenge. And so when I fed her dog food, she was not at all interested. I finally found this food that kind of smells like hot dogs, and she would eat that. And so that's what she eats now. All right, next slide. So bolting or wolfing, it basically means swallowing without chewing, or wolfing is swallowing without chewing enough. And there's some risks of this. So dogs can choke if they do this. They can vomit while they're eating, or they can also get what's called bloat. And that's when their stomach fills up with air because they're swallowing a bunch of air as they're wolfing their food. And then when the stomach swells up with air, they can get what's called a volvulus, so the stomach twists on itself. And that is a medical emergency. And actually, Stephanie, can I say, Stephanie's dog had that not too recently, and unfortunately did well with surgery. But so why do dogs do this? Some breeds are just more prone to this. So labs, beagles, basset hounds, cocker spaniels, corgis, dachshunds, and pugs, I guess, are more likely to bolt their food. It may be competition. So if there's other dogs in the house and they eat with other dogs and the other dogs try to steal their food, they may wolf their food. Or if they're excessively hungry, they may do it. And so I guess the point here is that some dogs, this is just normal. It's not necessarily indicative of a problem, but you may want to address it so they're not at risk of these health concerns. So what you can do is there's all sorts of different slow feeding bowls. There's a picture that's an example of one, but there's all different styles, which make it so the dog has to work harder to get the food out, and it just takes them longer to eat. There's also food puzzles, so you can make dinner time or meal time more sort of a game. You can scatter the food. I think one place I read said scatter in the grass and let them find their food. Or you can also, if you don't have like a slow feeding bowl, you can get some large stones, ones that are too large for them to swallow, but then put that in the food bowl and then have them eat the food out from around it. And then obviously if it's excessive hunger, you want to make sure you're feeding your dog enough. If it's competition, you can try separating the dogs, especially if there's like fighting or squabbling over food. You might want to feed them in separate areas. All right, next slide. So pica, which is also known as allotriophagia, is the consuming of non-food items. And if any of you have dogs, you probably know that dogs like to eat things that aren't food, especially when they're younger. And they might be especially drawn to things that smell like they're human. So things like underwear or socks or clothes. If you're lucky, they'll just chew on them, but some dogs will swallow them. And that's where you get into trouble. So the next slide, we'll talk about some of the risks. But in this case, 88% of pica is actually behavioral. So usually there is not a medical cause. It can be due to stress, boredom, anxiety. It can be attention seeking. So if a dog learns that when they have something in their mouth that they're not supposed to, and you react, they could do that more. And it could also be competition. If the dog learns that they have something they like in their mouth, but you try to get it out, they could try to swallow it really quickly before you can get it away from them. Brain disorders like a stroke could cause unusual eating behavior. There are foods or medications that increase hunger, like prednisone, other steroids, or phenobarbital. Phenobarbital is often used for seizures in dogs. The same diseases that increase hunger that we talked about in overeating can also lead to eating non-food items. And then things that cause malabsorption, so like inflammatory bowel disease, where the bowel isn't able to absorb the nutrients, or if the dog has parasites, where the parasites are getting too many of the nutrients. And then trace element deficiencies, so things like zinc, iron, cobalt, phosphorus. But I think the take home here is that usually this is behavioral. It's usually not a medical cause. And yeah, so let's go to the next slide. This is something that Zia dug up in my yard and was eating. And I actually ended up calling pet poison control because I'm like, I have no idea what this is. They said they would not identify mushrooms, but I guess this didn't count as a mushroom. So they did identify it for me. And it's some species of fungus that grows underground, and it's like an invasive fungus. Anyway, Zia thought it was a delicacy. It's not poisonous, but this is another example of she had pica because she was excessively hungry, and she was eating this one day. So the risks are, if you have foreign bodies in the stomach or the intestines, you can get ulcers or irritations. You can also get obstructions. If they swallow sharp objects like pens or things like that, they can get perforations or actually holes in their gastric. They can get toxicity. So I read a case study about a dog who swallowed a zinc knob, and the knob stayed in there for a long time, and the dog ended up with zinc toxicity. So the treatment, if there is an underlying medical disorder, it's obviously treating the medical disorder. And then the behavioral interventions would be making sure your dog has plenty of mental stimulation and exercise. that they're not like home alone in a room with all sorts of things they could eat, if you know that you tend to eat things. Work with your dog so that they can drop on command instead of swallowing on command. There's pheromone sprays that can help with anxiety. Adaptil is one of them. And crate training. So if you have to leave your dog when you're not home and they eat things when you're not home, you may need to crate train them so they don't have access to objects. And then there are medications that can help if anxiety is a significant contributing factor. So things like trazodone, which we use for sleep in humans, or clomipramine, which we use for OCD in humans, or fluoxetine, which you use for anxiety and depression in humans. So go to the next slide. So this is Bandit. This is my sister's dog. He also has pica, but his is driven by separation anxiety. And so he eats a lot of things, or he did eat a lot of things, and most of them he would poop out. But one day he ate a dish towel and that got stuck and kind of twisted around his small intestine. So he ended up with like open abdominal surgery. Fortunately, he's responded really well to just 100 milligrams of trazodone a day, and he doesn't eat things anymore. So treating his anxiety has helped him stop eating things he shouldn't. And then finally, next slide, we'll talk about poop eating or coprophagia. So according to one study, it's actually pretty common for dogs to eat poop. And I don't remember how they defined this, but in the study, about 16% of dogs are serious poop eaters. And what drives this can be like, so it can be a cleaning the den sort of behavior. So moms with pups will eat the poop to keep the den clean. It can also represent kind of their scavenging impulse, so a sort of survival behavior. And then the not normal are similar to the other things like that cause increased hunger or other types of pica or overeating. So the diseases that cause increased hunger can lead to increased poop eating. Anything that causes malabsorption, like inflammatory bowel disease. And then another dog who has a malabsorption, their poop might actually be more palatable or interesting to a dog who likes poop because they're going to be passing undigested food. So I thought that was interesting. Some other random facts: dogs prefer formed poop. They'll rarely eat diarrhea. Frozen poop is apparently a special treat. Female dogs are more likely to eat poop. 92% of poop eaters prefer fresh poop. 85% of dogs will not eat their own poop. And then what do you do about this? The interventions are similar to what you would do with other types of pica. And then there's a tablet you can give dogs that makes their poop not taste good, and it will often prevent other dogs from eating that poop, the poop of that dog. So if your dog eats its own poop, you can give it the pellet. And if it eats other dogs, you give the other dogs a pellet. Obviously, that doesn't help if you're going on a walk and your dog is scavenging out random poop. Why is it bad to eat poop? I mean, poop does contain parasites and it can lead to GI illnesses. And it's obviously not ideal. And one random fact that you may find if you get pet insurance for your dogs, they won't cover anything related to poop eating. I don't know why that is, but it must be a common enough concern that they've just kind of made that an exclusion across the board. All right, that's all I have.
These next couple of slides, we want to talk about projection of eating disorders onto pets. So this is based in clinical experience, consultations, things that individuals who have worked with eating disorders have seen more commonly in individuals who have pets and an eating disorder. And so one of the things that can happen is individuals can overfeed their pets, which I know I've been guilty of. I love giving pets treats. It's very fun for me. And we have to be aware of like what our pets' nutritional needs actually are and make sure we're meeting their needs. Sometimes people restrict their own caloric intake and overfeed their animals, which can be a way that the eating disorder can show up. Or on the other hand, individuals may underfeed their pets due to body image concerns, or trying to limit their pet's intake due to their own fears of gaining weight or desire for control. Sometimes individuals may engage in calorie counting for their pets as well. And, sometimes that's actually a normalized kind of thing or a thing that is actually recommended When my dog was having some issues and a medication that made him have more hunger, I was frequently recommended to give him really low calorie treats because he was just starving all the time. And so it's important to recognize that we can have some recommended kinds of behaviors that may be eating disorder behaviors, but may be necessary for our pets, while also recognizing there can be some eating disorder behaviors that we do project onto our pets. Both behaviors of overfeeding and underfeeding can be related to comorbid depression, like not being able to take care of oneself and therefore not being able to take care of their pets. Some other examples of projection of eating disorders onto pets can be overexercise. So individuals who do a lot of exercise may exercise with their pets or take their pets on really long walks or lots and lots of hikes, and really are focused on getting their animal more movement, which can result in exhaustion and injury for the pets. There can also be an over concern about food and health, so health anxiety, or focus on health for oneself and maybe projecting that onto one's pet. This can happen in orthorexia as well, which we didn't define earlier, but orthorexia is when someone has an obsession and compulsions that are related to eating healthily or having the most nutritious food for themselves and onto their pets in this case. And what we would recommend doing is focusing on your values and making sure you are moving towards your values and helping your pets live their best life.
All right. So now we're going to move into pet ownership, benefits of pet ownership, and benefits and how animals can be used as part of the therapeutic aspects of human-animal interaction. So first, talking about pet ownerships, obviously pets are considered an integral part of the family unit. And this is particularly true in the United States, where we have very high pet ownership rates. And there's some really wonderful research out there showing that pets can help improve health overall, and we're going to talk about that momentarily. But it does include things like reducing cortisol levels, increasing, serotonin levels and oxytocin levels, and improving cardiovascular health, and quite a variety of very true physiological improvements of interacting with pets and animals in general. But also, one of the outstanding benefits of pet ownership is that it provides social lubrication. If you're out walking a dog or going to a dog park, it can be a way to meet people, have social interactions, especially if you are not socially inclined, shall we say. It can be very help in those matters. They provide companionship, stress reduction, as I mentioned before, increases oxytocin, so the bonding hormone there, and improve physiological fitness. So having a pet, walking pets, taking them on hikes, those can be great avenues for improving one's own physical health and fitness. Thank you. All right, so a little bit more specifically, there are some wonderful therapeutic benefits of owning pets. Pet ownership offers a number of psychological and physiological benefits. So as you mentioned before, providing companionship and unconditional love and social support. This is especially seen in a lot of qualitative research, interviews with people, gauging their how they feel with interacting with pets. Sorry, my headphones got stuck on my thing and I'm getting pulled over here. Okay, sorry about that. All right, so providing that companionship, providing that social support can be invaluable, especially for older folks or people who are living on their own, but can also be invaluable for teaching a lot of companionship and social interaction with youth as well. So having kids in the home, or if there are kids in the home and having pets, that can be very helpful for that. And there's a lot of research showing that pet ownership can alleviate loneliness and depression. So obviously and that's integrally related to that companionship, but also related to some of the physiological effects of literally petting animals. So actually there's been a lot of research that just petting a dog, for example, what physiological reaction is there. And that's where we see a lot of the impact on neurotransmitters and hormones and just physiological responses to actually petting an animal that can be associated with reduced depression and anxiety. And they can consequently, very much related to this, also can help reduce symptoms of PTSD. So if somebody has post-traumatic stress disorder, having a pet, whether it is specifically a PTSD service animal, which is increasing in popularity, but that is in a different capacity. Obviously, that is more towards alerting for triggers of PTSD usually. But actually also petting their service animal, interacting with their service animal, or a pet in general can be very invaluable for people who are suffering from PTSD. And it can improve cardiovascular health. So there's some really interesting research out there about improved cardiovascular performance. Some of it related to some of these other physiological responses, but also just in general, improved cardiovascular health and reduced obesity. And part of that can be related to that fitness element that I discussed on the previous slide as well. So because of a lot of these benefits of human-animal interaction, actually somebody who has an eating disorder may benefit in many ways from having a pet. And so we discussed some of the projection issues and potential things to look out for. But on the flip side, there's a lot of benefits that can help assist somebody who is actually working at whether they're in treatment or trying to manage their own eating disorder. So one is to actually build healthy routines. So it can, using your pet is almost a different type of, not the projection like we discussed before, but actually helping to schedule meal times and exercise, involving them in that routine. That can be very helpful, whether it's setting an alarm, okay, we're both eating dinner right now, for example, or this is when we go exercise and this is for how long, right? It can also be motivation for recovery. So some people may need that additional support point and motivation for their actual own recovery. So I'm doing this for my dog. I'm doing this for somebody that I love and care about. They can, again, like I mentioned before, be social facilitators. So they can encourage positive interactions with people. And this can be especially helpful for people who may feel a lot of shame or stigma around their eating disorder. And the pet can be, again, part of that social lubrication and can help them encourage positive interactions with people that they may have otherwise avoided. And again, they can also provide comfort. So if somebody does have anxiety about socializing, having their pet with them can be helpful in that capacity. And they, of course, can help provide emotional support. So as we discussed before, they can help reduce stress and anxiety. They can alleviate depression symptoms and improve social bonding. And a lot of this comes from that human-animal interaction research that I mentioned before, which can literally stroking dogs and cats as well, and horses, actually, can produce prolactin, serotonin, and oxytocin hormones, as well as reduce cortisol levels. All right, I'm gonna move my little, okay, here we go. So now looking at the use of emotional support animals in eating disorders. So it's, again, taking this a step further from just discussing how having a pet how can emotional support animals actually assist people with eating disorders. So emotional support animals can be integrated into the personalized therapy programs for people with eating disorders. And this can improve a variety of ways in maladaptive behaviors, routine, and again, providing that comfort, security, and support. So in regards to the maladaptive behaviors, emotional support animals actually can help interrupt some of the maladaptive behaviors like binging. So for example, they could be trained to actually bark or alert another family member, or even the person to point out, hey, this behavior that I was trained to acknowledge and alert somebody to. They can actually help interrupt that. And again, similarly to what we discussed before with meal times and exercise, those healthy routines, they can actually be trained to help keep somebody to a specific schedule, as well as also being there as part of the encouragement to actually stick to that schedule. And that can be, again, things like mealtime, exercise, medication. And again, like I mentioned before, providing that comfort and security can be is obviously the key component of the emotional support animal. Again, they provide that unconditional social support that can help fight against stigma, act as that social lubrication, and provide that comfort and security in stressful situations that may trigger or be related to some of the eating disorders. And one of the really interesting things is they can provide deep pressure therapy, which are behaviors that can reduce anxiety and promote automatic relaxation in the body. And again, of course, improving social esteem and self-esteem and self-worth. And a lot of that can be related to, again, normally in maybe social situations, there may be this shame and stigma and avoidance of those social situations. But by being, proud of your dog, proud of your or pet in general, I know I keep going back to dogs, but it's because that's the majority of the research has been on dogs. But that can be very invaluable in feeling pride in what you're doing and in your dog itself, and then of course the comfort that they provide in that.
And we wanted to spend some time talking about the use of animal-assisted therapy with eating disorders. So, thinking about animal-assisted therapy, we want to think about it in general for those who may not know much about or may not be as familiar with animal-assisted therapy. So animal-assisted therapy, it is a goal-directed intervention where a human and animal bond is used to facilitate progress towards desired therapeutic outcomes. And so animal-assisted therapy has a long history. It goes back to the mid-1800s, where there were animals that were used in chronically ill individuals, and use of animals as companions in psychiatric hospitals and used as even a co-therapist, which I think would be really fun to have a pet as a co-facilitator. I think that anytime that one of my pets is joining a virtual session, it's always an exciting moment for everyone, me and the human that I work with, and vice versa. If their pet joins in the background of their appointments too, it can be kind of helpful and fun. So animal-assisted therapy, it has the goals. Animal-assisted activity does not have goals. And the animal-assisted therapy has been found to help children with emotional and behavioral disorders. It increases socialization, like Barbara was saying, with the social lubrication. It helps individuals feel more safe in the therapeutic setting and be more open to engaging. It can also help with problem-solving skills and self-esteem. There may also be help by activating the attachment system for new opportunities for an individual to help regulate their affect. Just wanting to make sure I cover all the things. Pets may help build confidence, and play with pets may help have a horizontal effect for younger individuals in their developmental stages. Animal-assisted therapy has also been used in reading programs and helped individuals struggling to read. And classroom pets, they're frequently used and help with motivation for individuals who are in classroom settings. Animals in therapy help give objects for someone's anger and emotions, so they're able to express the emotions, talk with someone while the therapist listens. And animal-assisted therapy has been used in emotional emergencies. So like instances of terrorism or having some workplace emergency happen. So animals have been shown to be effective and helpful in these various settings. Specifically thinking about animal-assisted therapy and eating disorders, it's a complementary treatment approach to eating disorder treatment. Further research is necessary. I think in general, further research is necessary in most of what we do in general, but further research is necessary. So if any of you are interested in doing research, please do it. But some of the demonstrated benefits of having animal-assisted therapy, specifically for eating disorders, has been an increase in cognitive flexibility. So this is reported by both patients and the therapist. Cognitive flexibility is where someone is able to have more flexibility, less rigidity in their thinking patterns. There's an improved confidence, which is reported by both the therapist and the patient. There's an improved ability to relinquish control. So one of the things that is really common in eating disorders is a desire to have and maintain control, and having more animal-assisted therapy can assist with this. I did not mean to do that, sorry. There can also be more healthy attachment modeling. This was reported by therapists typically. More healthy movement, which was reported by patients. More emotional safety and expression reported by patients, and then more positive or forgotten body thoughts, which were reported by patients, which I think is a really important thing for us to be aware of, as we know body image can be such a important and relevant and hard part to work on for individuals with eating disorders. I will say that these demonstrated benefits were found mostly in studies with dogs. There's also equine-assisted therapy that we'll talk about as well, but that's what the majority of the studies were on. Now, there are some reported negatives with animal-assisted therapy. Some activities were feeling too juvenile. Some patients were wanting more input from the therapist. Not being able to ride is specifically related to equine-assisted therapy, where individuals wanted to be able to ride the horses, which equine-assisted therapy does not always include riding. It's also really important for us to think about that there are some biases in this reported research, where most of the activities were involved with individuals who met certain criteria, and others were screened out due to aversion of animals or allergies. A lot of studies use horses and dogs. One study used adolescents, no studies used, no randomized control studies use horses and dolphins. And then there's a lot of other additional benefits that having pets help with the eating disorder treatment. It can add to allowing individuals to express and feel their emotions and tolerate their emotions. Some centers may use animals in more of the assisted activity versus animal-assisted therapy, but they have been found to be helpful to have dogs come in for groups, or dogs being available after meals. So individuals who are having eating disorder treatment and working on supported meals may be able to interact with dogs after, which was helpful in self-soothing and distracting from body sensations. And in general, the animals helped to build the rapport between a therapist and their client. Canine-assisted therapy, which I have to say, I think it's so fun that it's called cat and it's with dogs. I love that. So there were some short-term effects that were shown with lower levels of negative affect, reduced anxiety, reduced fatigue, reduced sadness and tension, increased social interaction, that's using that social lubrication, and reduced social withdrawal and aggressive behavior. There are also some long-term improvements in overall global functioning. And for some adolescent individuals who were looked at, an increase in higher school performance. So there's also some benefits for individuals who have autism spectrum disorder. There may be more opportunities for emotional expression, or more emotional expression that's demonstrated. And I've already said the other notes, so I will move on to our last official slide, which is about equine-assisted psychotherapy. So equine-assisted psychotherapy is an experiential therapy that is conducted with a psychotherapist, an equine specialist, and horses. It's not horsemanship, so that's why individuals were disappointed that they weren't able to ride the horses. And so what individuals do when they are engaging in equine-assisted psychotherapy is they are interacting with the horses versus actually riding the horses, or doing any movement that individuals may be looking for with horses. And through the process of working with an equine specialist in horses, patients actually are finding their own answers for what they are processing and what they've learned through the activities in their own life. So there's less direction and more letting the patients kind of explore and share what they're learning. So some of the other things to keep in mind with equine-assisted therapy is that horses are herd animals. They're not, they are very responsive to emotions. And so individuals with eating disorders often mask their emotions, so they're inauthentic. But to engage with the horses, for the horses to feel comfortable, the horses need more congruency with emotions, which then helps individuals feel more present and in the moment with the horses. And through different activities, which there's some really lovely articles out there that explain equine-assisted psychotherapy, and they're very powerful. If you ever have a chance to take a look at them, I'd strongly encourage that. But what patients are learning to do is set boundaries with the horses, have more positive touch with the horses through petting and through like brushing and helping care for them. And actually, body image distortions are addressed by comparing horses' size and shape with other horse size and shapes. And there are some treatment centers that incorporate psychotherapy exercises, horse care, and some riding, but not all equine-assisted psychotherapy does include horsemanship. Let's see. Some of the things that are really important in equine-assisted psychotherapy are contact. So a patient may stand against the horse and practice breathing together and noticing sensations, really being here and now and recognizing the me and the not me. There's work on the relationship with the individual and the horse over time. And then there's experimenting with contacting the horse and having activities that allow the patient to experiment and allow the clients to take the opportunity to have responsibility for actions and new awareness of how they interact with the world around them. There are also a lot of metaphors that are often coming up in equine-assisted psychotherapy, which can be useful for patients who are feeling more defended or guarded or struggling to connect with the therapeutic work. And these metaphors through the horses create more of an invitation to engage and allow the defenses to lower. Many patients gain a lot by observing the horses without even engaging with them or touching them or riding them, just by noticing how the horses are relating to each other, how the horses are just relating in general, and setting boundaries with one another and eating freely and being present. Which was a lot of words. And I saw one comment in the chat, which was someone's dog engaged in one of the behaviors a lot. But we wanted to move into allowing for questions. And so a big part of this presentation is we wanted to give you education, but we also wanted to answer any questions those of you who are attending might have. So I'm going to stop sharing, and hopefully this works. It does work. Does anyone have any questions for us? Or want us to go back to any parts that we maybe went through too quickly?
I don't have a question per se, but I think, I'll share that I've long joked that for our clients that tend to over-exercise, that I wish when they come to treatment that we could assign them like a senior dog. So they would have to walk just a little bit and practice mindfully walking their dog. And, I love it because I think, couldn't it be the most like mutually beneficial relationship for a sweet little shelter dog to get walks and, to have a natural limit? um, Knowing how empathetic most of our clients are, of course, they would be respectful of the dog's limits in ways that they're not respectful of their own.
It's an excellent point. It's wonderful.
Jill, make it happen.
Make it happen.
Make it happen.
I do know some people in animal rescue in Chicago.
There you go.
Thank you, Nicole.
Does anyone else have questions or comments?
I really liked when you were talking about like relating body image and different body sizes and shapes and all those things too, and how that can be done with equine therapy. I absolutely love that.
Thanks, Jill. We got a question in the chat. Can you elaborate on what you can do for a dog with pica?
Yeah, I mean, it really depends on the cause. And so I think, like I mentioned, 88% is behavioral, but you want to make sure there isn't an underlying medical cause. So if they have other symptoms of medical illness, especially like increased hunger and weight loss or weight gain, or more like if they're lethargic, you probably want to have them evaluated by your vet just to make sure there's not something medical to treat. And then if it's more behavioral, there's a lot of strategies. There is medication, and that's, as I mentioned, what ended up being the most effective for my sister's dog is 100 milligrams of trazodone. And then, making sure they're mentally stimulated. And so if they're at home all day without a lot of interaction and they're a high energy dog, it may mean having someone from Rover or a pet sitter come by and walk them and give them attention during the day. And then things just like keeping things out of their reach that they might otherwise eat. If it's a serious problem, they may need to be in a crate when you're not home. Do you have, I'm curious if you have a specific kind of scenario you wanted us to think through, Aviva, or a more specific question?
Wondering if silence means no, or if you're in the chat trying to type something
Typing,
out. Yeah. Yes. My dog loves to eat socks and other small clothing items and does it when we are not are around or not. So I don't think it's separation anxiety.
And unfortunately, I don't think that's that uncommon. And this probably falls in the category of they like it because it smells like you, and so they're eating it. I mean, my puppy does this too, and I just have to be super careful that I don't leave things lying around. I mean, he'll even follow me into the laundry room and grab something really quick. So it's more behavioral on my part, making sure I don't leave them around. But if your dog has other signs of anxiety, I mean, you might want to see it. My best guess is this is just like kind of dog behavior. I mean, doing some training classes where you train them to drop it on command, easier said than done, but that's, one thing that has been suggested. I don't know, Barbara and Stephanie, do you have thoughts?
I would just echo, as I said, I've had a couple of dogs in my life that have loved their socks and underwear. And yeah, exactly. I think a lot of it has be exactly as you said. Some of it's behavioral on our training on our part to make sure we kept them out of the way. But yeah.
I've luckily not had much experience with this. So no suggestions. There is a question. Do you have any thoughts about dogs that eat random things on walks getting muzzle trained? I have wondered if this makes them more frustrated.
That's an excellent question. I will say I'm certainly not an expert to mention that, but it makes me think of my bird. So I have a bird who is a feather plucker and kind of a skin mutilator, and I got her when she was 18, so I don't know what her history is. I don't know why she does it. But unfortunately, sometimes when she does it enough, I have to put a little collar on her, like a felt collar, so she can't pluck at herself. And the vet said something really interesting. It was like, that is effective, but also that's not addressing the underlying cause, right? And so can you imagine, like, if you had this severe itch and someone just put gloves on your hand and muzzle, and so that you couldn't scratch the itch? She's like, that's kind of what we're doing when we do it to the bird. And she's like, it's necessary because we can't have the bird making itself bleed. And so that is somewhat analogous, I think, to putting a muzzle on a dog while walking them. Although it's a little different because what they're doing is what we would call appetitive. They're wanting to eat something which is more pleasurable versus what I'm talking about with the bird is more aversive. So at least you're not preventing them from doing something to alleviate pain. You're preventing more of a desirable thing. But I do think anytime you can do behavioral things that aren't like a physical barrier are more effective and humane, but that doesn't mean you shouldn't do things that are necessary to protect them. So that was a roundabout answer to say it's probably not ideal, but also like I sometimes have to put a felt collar on my bird because I can't have her bleeding. And so if your dog is eating dangerous things, then you don't want to keep it in the house. Obviously, the dog needs walked, so you do like the least bad thing, right? So my
By the
dog
way,
knows the command leave it until it comes to food items where he is quick to swallow whatever he has gotten a hold of. Do any of you have any theories as to why that is and how to address it? Um, uh, my brain is going on a slight tangent because I have a puppy who doesn't know leave it when it comes to my small Chihuahua. And this morning I could not get my puppy off my Chihuahua. And I mean, the puppy did not break the skin, but it was rather terrifying and not good. Quick to swallow whatever he has gotten a hold of. I had that with my previous dog, Zia. Like, as you saw, she would eat anything and everything. And once she found a decaying rabbit, and before I could get it away, she knew I wanted it, so she like swallowed it. I think one of the things I was reading said it really is competition. And so if you're not trying to get it away, oh, he's a street dog before I adopted him. That totally makes sense.
Yeah.
So reminiscent from when he had to scavenge. And I think that's what it was with Zia. Zia was so hungry, which was sad, but that she, you know, it was competition. If I was going to take it away, she was going to make sure she swallowed it quick because she did not want it taken away. So that totally makes sense about the scavenging. How to
Yeah.
address it?
My reaction to how to address it, I just am curious if you've tried like doing a trade. I've had pets that would quickly swallow whatever they had, but if I offered a trade, we could kind of exchange. So if it's like something that, you know, you don't want your puppy to consume, maybe you could trade a treat. I think that might also reinforce the idea that you can do the trade. But if it's like something very, very dangerous,
Or
you know,
disgusting.
Yeah.
harm reduction, right? And I love that it's frustrating and you still love him. Of course you do.
Exchange is interesting too, because it does mean you have to slow down your own initial reaction, because your initial reaction is to quickly grab it, but instead you have to slow it down, go get something, and then ask them to trade, which can work, but yeah.
Or you could just like have a fanny pack with treats for trade all the time with you, so you're always prepared. Any other questions?
Fanny cat packs are
There
coming
you
back
go.
in style. Very possible. Yeah.
I'm the epitome of fashion.
I'm curious, Carly, what kind of street dog? Corgi Nova Scotia Retriever mix, originally on the streets of Kansas. Aw.
He's lucky to have you.
All right, well, appreciate everyone attending. We will send you the link to the video, so you can feel free to share it. We'll probably get it posted today. It'll be on YouTube. So thank you for coming.
Thank you, everyone. We appreciate you. Bye.